and gentlemen, past presidents, presidents-elects, medical women, international president-elects, chairman of this plenary, it is indeed my pleasure to be here. What I want to know is the slide showing president-elect's plan because of MWAN. Some of us are past that. So my topic this afternoon is on strategies for greater engagement of Medical Women Association of Nigeria in the global clinical trial enterprise. The next slide is showing next slide. Professor IFEOMA Okooye has already introduced. I'm director of the University of Nigeria Center for Clinical Trials, which is actually serving as a model of which I'm trying, for instance, to see if medical women can champion in their different institutions. So clinical trial is definitely the next frontier for growth and revolution in Africa. Every time we talk about diversifying our economy, this is definitely one of those gateways in which we should. However, it's not only for monetary gain, but indeed for building the capacity of healthcare in the African region. So we looked critically at the efforts that Association for Clinical Practice in Nigeria has been doing for the past 13 years. And in 2016, we decided to make this trust to be an all-Africa effort. According to the Rwandan president, it's only by integrating efforts across the African region that we will be able to have sustainable development and progress in Africa. So we strategized and we launched Clinical Trial Africa Vision 2020, and we're in 2019, so we have just 1 year to go. But fortunately, we've been able to make very, very huge steps forward and have been able to achieve the formation of African Clinical Trial Consortium. So African Clinical Trial Consortium actually is a strategic model for the future of clinical trials in Africa, and it's to serve as a gateway to developing quality management systems. So as I said, I'm sure you're seeing the slide for Association of Clinical Practice that gave rise to Clinical Trial Africa Vision 2020, and this network in 2017, when we did the first All-Africa Clinical Trial Summit, at which the President-elect, Dr. Oseji, was hugely participatory and contributory. So she was one of those that developed a community post-2017 first All-Africa Clinical Trial Summit, and she understood that definitely there is a role for Medical Women Association of Nigeria to play in this enterprise. So the concept of the African Clinical Trial Consortium, the theme at the second All-Africa Clinical Trial Summit was took place in Cape Town last month, 16 to 18th of August. And it's a strategic model, as I said, for the future of clinical trials in Africa and a gateway to developing quality management systems. So why did we think that we needed to create a strategic model? The intention of the 2019 conference was to propose a system for the development, the training, the establishment, and the sustained mentorship and oversight of accredited clinical trial units in each of the African countries, of which ONSEC that was formed as UNN is one. This will build confidence in industry and funding agents, which is critical to the growth of clinical trials according to good clinical practice. So all trials now in high-income countries are required to be supported by clinical trial units. And this was not an easy transition, but it instilled confidence in the industry and funding agents alike. Thus, it is a good strategy for clinical trial units to be established in African countries to achieve efficiency, harmonization, and international standardization, which will instill confidence quickly and efficiently with minimal cost and sustainability of clinical trials in Africa. And we want to have Medical Women Association of Nigeria be a considerable part of this feature and be the drivers of establishment of this clinical trial unit in their centers. So next slide. Improving the prospects of infrastructure and human resource development in the health sector in Africa by creating a framework for sponsored clinical trials that will make the continent an offshore outsourcing destination for ethical clinical trials. People are looking, the sponsors of clinical trials are looking for new regions. Because of lack of time, I will not be able to go into the details of why there is an effort to go into new regions. But I can tell you that definitely it's not because they are looking for guinea pigs. It's because it's actually counterproductive to the African Union, the African region development if we do not get involved in the clinical trial process. We'll be doing a disservice to our population if we do not engage the genetics of our population within the process of genomic wide studies that are going on right now. We are already left behind in even the mundane efforts that have been made in the past. And the world is leading us behind and we want to catch up. There's even an effort now to include artificial intelligence in the entire structure of the clinical trial process. So essentially, the plans of the African Clinical Trial Consortium is to enhance the integration of Africa into the global clinical trial enterprise and contribute to the transformation of African economies, of which I've told you is a 1.3 to 1.5 trillion industry. If you look critically at different industries across the globe, you will find that in fact, there is none that can actually compete with this level of funding. Now, people have said, and that is of authorities, have said that clinical trial is capable of empowering Nigeria sustainably and more effectively than oil and gas. So you can imagine where we are headed to if only we can do this in line with the African Union's agenda. So just one slide to explain why it is imperative. I've alluded to some. There's a disproportionate nature of Africa's huge disease burden in comparison to the rest of the world, and there exists disparities in subtype and presentation characteristics. We already know for breast cancer, there exists for prostate cancer, and there exists for other types of cancer. And these are just being found out in the clinical trial process. And we must engage our population in this process so that the subtypes that express themselves here will be able to know what to do, rather than have drugs developed with another population and in one cabinet of which we know that has not been working. So there is also another gap, that is the poor clinical trial funding, where there is a vicious cycle that will lead us to inability to set our healthcare priorities. Because when you are able to establish data to show that this is what is the situation on the ground, you will be able to prioritize your project, your standard, prioritize where the money is going to. So you use it to drive policy. So poor representation in genome-wide studies and precision medicine, leaving Africa holding the wrong end of the stick. African health research capacity output, plus the low volume of clinical trials, is definitely counterproductive to the vision for a healthy Africa. So let's look at some data. This first graph, I don't know, I see graph. Is that what you're seeing on it? This is not.